Just as we ease restrictions here in California and around the nation, some doctors are sounding the alarm. They fear a new surge in Europe could hit America next. About a dozen European countries are seeing a spike in cases. Experts say this new surge is being fueled by the Omicron variant BA.2. Early reports show it's about 30% more contagious than the original Omicron, but the experts it doesn't seem to be, they say it doesn't seem to be as severe. BA.2 now makes up about a quarter of new cases here in the U.S., but the CDC is not sounding the alarm just yet. So how concerned should we be about this variant?
Joining us once again now is Dr. Jose Mayorga, Executive Director at UCI Health Family Health Centers. Doctor, welcome. Thanks for being with us once again.
Thanks for having me.
Doctor, cases are spiking in Europe again, as we just talked about right here. We've seen a similar pattern, of course, before, where a wave first hits Europe, then comes to the U.S. a few weeks later. So how concerned are you that this is going to happen again?
Well, we've definitely seen this movie before. It feels like we're in a constant rerun. But I am concerned knowing that we will be seeing an increase in cases in the upcoming weeks. This subvariant is a lot more aggressive. It spreads a lot faster. And yes, we kind of appreciate that it doesn't cause as severe disease, but that has to do with some of the information we know about already folks being infected and or fully vaccinated.
Can you tell us a little bit more about BA.2? What have you all learned so far and how it really compares to the original Omicron variant?
Well, yes, we understand that this is a subvariant of Omicron. As I mentioned, it's about 30% more spreadable. In other words, it moves a lot quicker. And that's what we're seeing in Europe. They reduced their mandates, they removed a few of their precautions, and that's why you see the uptake. Now, I think the situation here in the United States will be a bit different. And here's why. It's estimated that about 45% of the US population got exposed to Omicron already. And so this in itself is going to present all of us that got infected some immunity against the subvariant. Now, the other folks that are in a very good position are those who are fully vaccinated and boosted. These folks will likely have mild disease and not require hospitalization if they confront this subvariant. What worries me the most are the people that have yet to get infected and yet to be fully vaccinated. Those are the people who will ultimately have challenges with this and may end up in the hospital.
Yeah, no doubt. And Doctor, the CDC is confirming there's also been an increase of COVID in several wastewater samples. This apparently happening nationwide. There's concern that could be a troubling trend as well. What are your thoughts on this?
Well, this is a very interesting thing that doesn't get talked about a lot. And it's important at this time. Here's the reason why. With wastewater, we typically monitor various things in it. We monitor viruses, we monitor bacteria. And of course, we've been monitoring COVID. With increases in COVID and wastewater comes number of cases in the community. And so right now, what is available to us at home? These rapid home tests. Those rapid home tests do not get counted towards the overall numbers that we see. And so we have to be a little bit more nimble in making assessments of when we need to take more precautions. Wastewater is one of those tools that's going to help us make those decisions.
Yeah, makes sense, huh?
Yeah, well, but, doctor, restrictions have been lifted and, people are now ditching their mask again. So it gets a little confusing. So what should people really be doing now?
Well, I know people, want this pandemic to end, but I have to reemphasize this pandemic is not over. We are not in endemic state. That's a really important point. We are seeing waves still of this infection. So I simply encourage people to do the basics. If you haven't been boosted, do so. Right now, only 57% of the people that live in California have been boosted that are eligible. So please make sure you do that as soon as possible. Of course, our children who are eligible, if they haven't been vaccinated, make sure they get vaccinated. We know that mandates in schools are up and no longer are required to wear masks. So let's make sure we protect our little ones too.
Yeah, some good advice coming from Dr. Jose Mayorga. Thanks again for joining us today. Thanks, Doctor.
It's my pleasure.